4, 3, 2, 1.
Hi, good morning and good afternoon and good evening to all of you. This is Katarina Albuquerque. I'm the CEO of SWA, and together with UNICEF and WHO, we would like to welcome you all to this webinar. I first would like to make sure that you are listening to the right language version of this webinar. I hope that you can see a button at the bottom of the screen with a map, with a world globe and saying interpretation. If you click there, you can choose your language version. Maintenant, en français, soyez les bienvenus à ce webinaire au nom de SWA et nos partenaires.
Actually, welcome to this webinar.
We are glad to be doing the webinar together with UNICEF and WHO and also feature representatives from a number of governments. We will also be receiving inputs, for example, from the World Bank, and also questions from you via the different chat platforms that you are a part of. My colleagues in the Secretariat will pass on your interventions to me. A few housekeeping notes. We'd like to know who is joining us for this discussion, and so we ask that you add your names to the chat box where you are joining from and the names of anyone else you may be with. That's number one. I hope that everyone can hear me in English. I'm receiving some messages of people saying they cannot see me, they cannot hear me. Now they are saying everything is good now, so I will continue. So as I was saying, use the chat tools. This webinar will last for 90 minutes. Number three, we will have time for discussion throughout the webinar, but you are welcome to leave comments or questions in the chat box, and we will come back to them, either today or later. Please also use the chat box to make suggestions of things that you think we can promote at SWA that you think could help you in the context of COVID. Before we hear from our presenters, I would like to tell you about why at SWA we are convening this webinar. SWA's vision is simple: water, sanitation, and hygiene for all, always, and everywhere. Each word in our vision was carefully selected. When we talk about always, we mean championing sustainable, climate resilient water and sanitation services, ensuring human rights to water and sanitation are realized at all times, including during and after crises or disasters. COVID-19 threatens the gains that we have all made in the last few years. However, we all know that water, sanitation, and hygiene are the first line of defense against the spread of the virus. Okay, people are asking me to explain again where to click in order to listen to this in English. You need to click in the button at the bottom of the screen where you see the word interpretation. You click there and you will see an option saying off, but then 3 language options: English, French, and Spanish. You click in the language that you want to hear the discussion in. Okay, there is also an icon saying chat, and you can write there. And you can also use all the WhatsApp groups that you all normally use in the context of SWA. Let me move forward. I forgot what I was saying. I'm sorry. Okay, I was talking about the threats. However, we also know, I've said that already. So COVID is happening at the time of serious inequalities. Governments are making choices about where and how to invest their limited resources. We need to ensure that services are available for all and everywhere, not just in our homes, but also in health centers and other institutions. COVID-19 challenges the entirety of our common vision. We have to work together as partners to find and share the best solutions on WASH and COVID. This way, we can together preserve the gains we have made, protect the vulnerable, the poor, and the most marginalized, catalyze political leadership, use this moment, transform this critical moment into an opportunity, and ensure that there is a whole of sector approach which will also prepare us for the next emergency, whether it is associated with disease, climate change, or something else. At the current critical time, access to reliable data and information, promising practices, and thought leadership is crucial. We count among our partners many of you who are working at the front lines to lead the response to the pandemic. At the global level, as WHO, UNICEF, and the World Bank, but also at the national level, through government agencies, civil society organizations, private sector, and research institutes. COVID is a global crisis which requires all of us to do our parts. So we would like to share these key messages before we get into the details of the webinar. WASH, again, is the first line of defense and the best tool to alleviate and spare national health systems from COVID. A society is only as healthy as its most vulnerable members. Inequalities in access to healthcare, as well as water and sanitation and hygiene, risk everyone's health. In the case of COVID, we are seeing that the elderly and those who have underlying health conditions are most at risk. In many countries, these are the same people who are marginalized and who already, before this crisis, did not have access to water and sanitation and hygiene facilities, hence increasing their level of risk due to where they live or social attitudes. Governments must take, and many are already taking, particular care to make sure that low-income households, particularly female-headed households, have access to adequate and affordable services. Adapt Communication and messaging to all audience is one of the other messages. We must review existing hygiene promotional materials and include comprehensive COVID-19 sensitive behaviors according to global guidance, and WHO and UNICEF will talk about it now. Consider population with impairments, people with different ethnic or religious backgrounds to improve uptake. We also need more and flexible investments. We must make resources available to expand services to those without access, maintain services for those who currently have services, and sustain services for all. We must think of today, tomorrow, and the day after tomorrow. Invest in healthcare facilities. We need flexible financing arrangements from different sources, national, regional, and global actors. And this is why our colleagues from the World Bank are also joining us today. The WASH community needs to get better at communicating the role of WASH in the preparedness, response, and aftermath of this crisis. COVID is not just a health issue, it is a WASH issue. We all know that. And finally, at last but not least, strong systems protect people against public health threats. COVID-19 is demonstrating the importance of what our partners work towards, countries with strong, sustainable, and resilient systems. I will now stop. Thank you for your attention and move and call on my colleagues from UNICEF and WHO. And in this particular context, I will call on Ms. Kellyanne Naylor, who is the Associate Director for the WASH section within UNICEF in New York. Kelly, welcome, and the floor is yours.
The whole part of WASH, water, sanitation, and that H at the end, hygiene, are going to be absolutely critical and important to both stopping the spread of the transmission of the infection.
Kelly, sorry, can I just interrupt you? Can you click the button and select English so that what you are saying is interpreted in other languages? I'm sorry to have interrupted you.
Okay, no problem. Désolée pour tout ce que j'avais raté la traduction. Okay, great. So WASH and as we said, this H part, hygiene, are going to be absolutely essential to stopping the spread of this virus. And also that we need to make sure that water, sanitation, and hygiene services are continuing. And for those of us, myself, I live in New York, where we're living in places that have been locked down, where there's movement restrictions. We need to be able to see how we can keep these vital services flowing during this essential time. So we hope in the coming minutes, we'll be sharing with you critical information and having a discussion that will really enable you to have the tools that you need to be able to really use all the powers that you have as a water, sanitation, and hygiene actor to address this issue, whether it's in healthcare facilities, schools, public places, communities, or at the household level. So thanks so much. And so today in this partnership from WHO and UNICEF, I'm going to hand over now to the colleague Maggie Montgomery from the World Health Organization, who is going to take us through the science and understanding what we can do as WASH to be able to tackle this challenge. So Maggie, over to you.
Great. Thank you, Kelly, and thank you, Katerina. So I'll ask to go to the next slide, please. So these figures, apologies, this is actually from 2 days ago, and I quickly looked up today to see what the change has been, and we've seen a 25% increase just in 2 days. So today, globally, we have 416,000 cases, 18,589 deaths, and it's in 197 countries. So truly, this is a global epidemic. It's evolving very quickly, and I really look forward to hearing from all of you about how things are changing on the ground where you are and what measures are being put in place, not only to prevent further spread, but to adequately address those that are sick. Next slide. So I'm going to talk a little bit about the evidence. As Kelly mentioned, with UNICEF, WHO published a technical brief that really went through the current evidence around both the virus which causes COVID-19 as well as other coronavirus, as well as highlighting the existing evidence that's relevant to COVID-19, both in communities and healthcare facilities, but also schools. This document has now undergone an update. As you can imagine, the evidence is rapidly evolving. It hasn't changed our conclusions drastically, but we have added a lot more information on and options on hand hygiene, as well as on sanitation treatment, especially in situ treatment, recognizing that as COVID spreads to more of the resource poor countries, that there's going to be many more challenges with the WASH services. It is being translated into all 5 UN languages and Portuguese as well. Next slide. So what are the key messages? Obviously, hand hygiene is one of the most critical measures to prevent COVID. And given that we're seeing a lot of shortages in personal protective equipment around gloves and masks, the hand hygiene becomes even more important. I'm sure you've all heard these messages already. The second message is that the stopping and preventing the spread of COVID doesn't require that we do anything different. All our existing guidance on safe management of drinking water and sanitation applies. And I think that's really important to emphasize, that we don't need newfangled inventions or to come up with different disinfectants. It's all there, but we need to do what needs to be done even more urgently because of this outbreak. Obviously, there's many COVID benefits for WASH, and I think that's important not to understate that, because on the medical side, we see there's actually many risks to some of the treatments and some of the other things that are being proposed. But for WASH, it's obviously a win-win. I highlighted here an extract of a recent publication that we developed for the health sector on what are some of the key statistics around WASH, but also what can be done. And there's approximately 1.87 million deaths every year that are related to poor WASH. So if through COVID, if we could make a dent in those deaths as well, it'd be really fantastic. And the last thing, just to emphasize, and Katerina already very eloquently talked about this, is that any WASH actions and investments should be part of wider country response plans to COVID. Next slide. So for all you techie people out there that are interested in learning a bit more about the virus and the microbiology, first of all, just to highlight, we don't have any evidence right now that viable COVID virus is found in drinking water or sewage. We also don't have any evidence that other human coronaviruses, and there was some work done on this after the outbreak of SARS back in the early 2000s, has not been found in surface or groundwater. And part of this may be because it's relatively fragile in the environment. It has an envelope, and the envelope is a bit of a misnomer because this envelope can be easily broken and damaged by any kinds of oxidants. And without that envelope, the virus isn't able to attach to a host and to become infective. On the diarrhea side, this figure is slightly outdated. We're now seeing up to 1/3 of patients have diarrhea. But the diarrhea is not necessarily associated with finding virus fragments in the stools. And increasingly, more and more studies are coming out finding that there are virus fragments in the stools, the RNA strands, but we still only have one study that has found viable culturable virus in the stools. Next slide. So survival, I won't go through all of this. I'm sure you've seen already a lot of it in the news, especially around surfaces. But just to emphasize that it can survive anywhere from a few hours to days and up to 2 weeks in water and sewage and on various surfaces. On the water figures, these are water that's not chlorinated. Chlorine is really effective at removing viruses, in particular enveloped viruses. And I was just looking at the data yesterday, and in about 5 minutes, you'll get up to 4 or 5 log removal of the virus using typical chlorine concentrations. Maybe the last thing just to highlight from this slide is that the survival is obviously very much dependent on the temperature. Higher temperatures, it doesn't survive as long, as well as the humidity, as well as what is the initial concentration of the virus. Next slide. Okay, I've covered a lot of that first point already. On the second point, just to highlight, just like we see in drinking water, we also see on surfaces that you can get really effective, almost complete inactivation of the viruses in just 1 minute using the 2 most common disinfectants that are used in healthcare facilities, which are 70% ethanol or sodium hypochlorite. And then finally, just to note that data on the transmissibility of the coronaviruses from a contaminated surface to hands has not yet been found. Next. Okay, so just to highlight a few of the key points from the existing guidelines that are really important to remember in thinking about, okay, what are the measures that need to be taken to make sure not only that our water and sanitation supplies are safely managed, but if risks are shown that it possibly is in these supplies, that it can be prevented. Obviously, using the water safety approach is really important about protecting from the source all the way to the consumer and looking along that chain to see where the key breaches in safety are found and how they can be addressed. As I mentioned, chlorine is a really effective disinfectant for water, and all water supplies, we should aim to have them chlorinated. And then lastly, where safe piped water isn't available, there are a number of point of use treatment products that work against viruses, in particular many of the ultra and nano membrane filters, UV, solar, as well as chlorine. Next slide. On the sanitation slide, as many of you are aware, WHO came out with new guidelines 2 years ago on sanitation and health. And again, these really emphasize looking along the entire sanitation chain from use of the toilet all the way to end use and disposable. And there's a lot of really fantastic technical guidelines or technical details in these guidelines about the types of different systems that can be put in place. One thing I wanted to highlight is the importance of safe plumbing is important. And we have at least one study so far that suggests there's been aerosolized fecal matter in apartment buildings that have infected other apartment buildings and other people. So it's really important that things like bathroom drains, backflow valves on bathroom sprayers and faucets are all in place. Also just really wanted to highlight that obviously regular cleaning and disinfection of bathrooms is important, along with the fact that we do have many simple wastewater treatment technologies that can remove several logs of viruses over time. Next slide. On the hand hygiene, it's been really interesting to look at these issues of hand hygiene with my infection prevention control colleagues. They've been working in this area for obviously decades, but in the past 10 years have done a lot of work on the multimodal approach. So obviously the infrastructure and resources are important, but along with having training, having checks, having reminders, and having a culture. And as we see also this shift of the COVID towards less resource or countries that have less resources, and the importance of hand hygiene also in homes and communities is probably going to increase, because we know that we have, for example, up to 3 billion people worldwide that don't have soap and water to wash their hands at home. we're going to have to think really carefully about how some of the lessons in the healthcare facilities can also be applied to communities, and also vice versa, because I know the WASH community has also done a lot of important work on hand hygiene in communities. Next slide. Safe healthcare waste management. So this isn't something that WASH people are necessarily very comfortable with. It is something that under our broader umbrella work between WHO and UNICEF on WASH and healthcare facilities, we are addressing as part of the sanitation issue. Fundamentally, it's really about making sure waste is segregated and making sure that the infectious and hazardous waste streams are dealt with differently. In households and in communities, we are not advocating that waste should be separated. And when I say waste, I mean Kleenexes or other potential waste generated by patients who are at home or people who are sick, but rather all waste should ideally be bagged and picked up by some kind of municipal service. Next slide. Cleaning has been a big neglected area, and again, this is something that we're finding is increasingly becoming relevant with this outbreak, given that the virus can spread through droplets and before cleaning, and many studies are finding that COVID is in patients' bathrooms, it's at their bedside, but the majority of studies have found that the cleaning procedures that are in place in developed and very highly resourced countries are working. So we need to make sure as it shifts again to places where there may not be the same amount of knowledge or training or supplies, that we continue with these effective cleaning practices. Next slide. Okay, I'll just hand it over at this point to Kelly, who's going to talk a bit more about the response and what as a WASH sector can be done and should be done. So over to you, Kelly.
Great, Maggie, thanks so much. And I think just it's absolutely fundamental to understand the science behind this, because I think, you know, where WASH is going to be effective in stopping the spread of the outbreak, it's going to be in understanding really how we're going to break those transmission pathways. We need to know what the risks are, and we need to know what to do. But what I'm going to talk about in the next couple of slides is how to do it, because we know that being able to implement these interventions is going to require massive action. And, you know, we're so happy to see so many of you here today, because this is something that needs action at national level, at district level, and at community level. So this is really what we're going to talk about in these last couple slides before we tie up this presentation. When we look at this, this is a public health emergency. And so many of you are usually familiar with things like the WASH cluster and other architecture that we have during humanitarian response. But since this is a health emergency, it's something that is really going to be led at the global level by WHO, at country level by the Ministry of Health, and it's going to be organized around response pillars. And so when we look at how WASH fits into this public health emergency framework, we can see ourselves really fitting in two key areas. The first of one being risk communication and community engagement. And this is really where we see the work that we're going to be doing on hygiene promotion, putting in place the hand washing with soap, which has been one of the key messages, and also looking at other personal hygiene measures to be able to stop the spread. The second one is really under the pillar related to what we call infection prevention and control. And this is really looking at places where we can see the infection spreading, breaking those transmission pathways. So in the coordination, we would want to see WASH and those of you who are coordinating this to make sure that you're present in the risk communication and infection prevention control working groups. Next. So in your country, as I said, this is going to be based on the pillar system, but in countries that have WASH clusters, we also see WASH clusters being mobilized because while it's a health emergency, we know that this also affects the wider country. So you will also see other sectors, including the education sector, for things like WASH in schools and other areas where we would see activation of other sectors. And the response in each country is going to be really country specific. So the things that we are going over today are the generics, but you will have to look in your country about how you're going to tailor these different tools to be able to work in your country environment. And we strongly suggest that you look at entry points in your existing programs. Many of you may have community-led total sanitation programs that are working on behavior change. You may have national hygiene programs. You might have national WASH in schools programs. So we really recommend, as much as possible, build on your strengths. Look at everything you have in your country that can be mobilized already for this response. And we do suggest engaging all stakeholders, including donors, to be able to engage them and let them know what they have to do to be able to support the response that's going. And we also recommend attention around existing emergency responses. So we know that the COVID emergency isn't the only one, and many countries might have IDPs or refugees or other disease outbreaks. So you need to make sure to keep attention also on these vulnerable populations during this time. Next. So when we look concretely at what we do, and in the guidance that Maggie talked about, you can look at some of these entry points. So certainly we won't go into all the details, but certainly WASH in healthcare facilities is going to be essential. And that's really both healthcare facilities that might be treating patients, but also healthcare facilities that might be receiving new cases. And one of the really critical things, and I'm seeing this even here in New York, is that we need to make sure that the health system keeps up and running, because we know people won't only be sick from the coronavirus, they'll also need to be able to have treatment for other things. Babies will continue to be born. So we need to make sure that healthcare settings and hospitals and all types of healthcare facilities have infection prevention and control. And those points are really outlined. And we see that this has an overlap between what can be done by the WASH sector, but also what needs to be done by the medical sector in terms of also managing infection prevention control in healthcare facilities. And, you know, many of you, I know some of the countries that I see here have used the WASH Fit tool. You also have the documents on the 8 practical steps that came out last year with the joint monitoring program guidance from WHO and UNICEF. The report came out. There's a report also on the 8 practical steps. So you can find some information in there about what to do in healthcare facilities. Next. So schools is a very specific environment, and many countries have closed schools, and that is certainly now looking at how children are transitioning into other types of learning through radios and through online learning. But in countries where school is still going on, we do have key practices and prevention measures for schools, and this has just been also approved by the Interagency Standing Committee, and you'll have the link to this at the end. We know one thing that's very important in countries where schools have been closed is that there will be a large effort to reopen schools. And in the experience that I had working in West Africa during the Ebola virus outbreak, WASH in schools will be a big focus focus of these back to school programs. So you need to already start thinking about in advance how you're going to, in countries where schools are closed, how we're going to put in place these wash and school measures to be able to make sure that schools can reopen safely. And again, there's dedicated guidance that can be used with your education colleagues on the school environment. Next. So now when we look at communities and households, this is a detailed slide, but just to let you know that that there is guidance that's available that is around what needs to be done in these environments. But we do need to look at any places, first of all, public spaces where we could see, people coming together, grocery stores, markets, these types of environments, public buildings. We definitely need to make sure that there are water and sanitation and hygiene facilities available in these spaces. And I did want to also mention that we are receiving a lot of questions about what to do in difficult contexts. We have contexts where there is water scarcity. We have contexts like informal settlements or urban slum areas. So all of these are going to really require specific attention at the local level to be able to find solutions that can protect people and workers that are in those environments. And so I think, when you're developing your country plans, you'll need to look at the risks and look at the solutions that will be context specific for those areas, whether it's public spaces, whether it's areas where you might have a suspected case, or in households where we might have people who are under quarantine or other types of closed conditions, where we need to make sure that we have wash facilities available so that people are not moving out of those spaces. Next. So one of the other things, and I mentioned this in the beginning, is we've been thinking a lot about how do we get WASH in place to stop the spread of the virus. But one of the concerns that we also have is that some of the measures that are being put in place, such as closing airports or restricting movement of workers, or different types of economic slowdowns, that all of these things could impact water utilities or water service providers to be able to continue those life-saving services to provide water and sanitation services during the emergency. And we know that this would obviously have really huge impact if, a city or a town were to have disruption in their water supply services at a time when we're trying to upscale the response. We're also concerned about stock out, or basically running out of critical supplies like soap or other cleaning materials. So these are the kinds of things that we think that everyone needs to be in the WASH sector to be monitoring this, and to be looking at the types of measures that can be taken with government and with service providers to keep these systems flowing. Next. So just as I mentioned, there's a number of key resources that are available. I imagine, Katerina, that this presentation will be on the SWA website, or people will be able to have access to it. So you'll be able to download this guidance, and certainly through SWA, you can contact UNICEF and WHO, and we'll be happy to answer your specific questions, either at the country level or at other levels, if you have specific issues or questions. And I think I'm handing over now to Bruce for the close. Is Bruce there? Bruce, there you are. Okay.
Hello. Well, thank you, Kelly, and thank you, Katerina. And sorry, I've just been entranced in the chat room where we're getting a lot of good questions and answers. So hopefully we can get into that. But no, I just wanted to say, on one level, I think there's a lot of complexity to how we respond and adapt and ensure that we get adequate continuing funding and more funding for our important efforts on WASH. But I also think, and certainly in our organization, we've got to change and optimize the narrative so people that understand that the health response is a WASH response. So in other words, even in WHO, when we're talking to our country and regional offices and discussing this amongst ourselves, it's not that any WASH response will take away from a health response, it will add to it. And I think when we really drill down and simplify, and I've heard some questions about how we, accommodate this with our existing work on enteric pathogen reductions, which is essentially what we do. This complementary. 75% of sub-Saharan Africa right now, we know, do not, from our UNICEF WHO figures, they do not have a hand washing facility with soap and water. That means we have a serious vulnerable population, and I think we're all frightened about that. And is the case for many places in the world. And that's what we're already doing. That's been our sort of raison d'etre since we've got in this business. So we need some urgency to that, but I think that it's very simple. We've got to do what we do better, and we've got, as Kelly was saying, we've really got to think carefully about how we position this. So there's some of the technical questions we can get to, but I think broadly this sector is doing frontline prevention work, and we need to keep doing that. Over.
Thank you so much to both Kelly and Bruce and Maggie and other colleagues who supported in preparing this presentation. I think it was very important to get the science out there for us to understand. And I think that the idea, getting back to what you were saying, Bruce, the idea of organizing this webinar was to bring the whole sector together, to motivate us, to raise the political visibility of the sector, to align ourselves in terms of the messages, because as you were saying, this is about preventing and the first line of defense against the COVID. And what we feel, and this is what we are hearing from several partners, is that the accent is being put a lot on other types of interventions after the infection, which are obviously indispensable, but let's also talk about how to avoid it, how to prevent it, and then how to sustain attention from political leaders to water, sanitation, and hygiene. This is a huge challenge for the globe, and answering a question, a comment in the chat, maybe because it's affecting everyone, virtually everyone, it is becoming so visible, and you have heads of state and heads of government calling on people to wash their hands. You have WhatsApp challenges on hand washing, but let's not lose the momentum. Let's transform the challenge and the problem and the horrible tsunami that is hitting us into something good, into something positive, and into sustainable services for all and forever. Okay. This discussion should have, we are late. Basically, that's what I want to tell you. There were some questions in the chat box, and I'm very sorry. I will give 2 minutes to each one of the two of you, Kelly and Bruce, to answer the questions. There are questions directed at WHO regarding the presence of feces in, for example, in wastewater, and other type of technical questions. Maybe you could address those, Bruce, and then Kelly, if you see something that you would like to comment on, that would be great. But we will find a way for everyone. We will find a way of getting back to you with written answers after this is done, or we will organize another webinar. Over. Please, Bruce.
Okay, thank you very much, Katarina. I'll start with the wastewater and excreta question, I think, which has really been a big concern among the whole community. And I just wanted to say that there's many scientific journal articles coming out and saying there is viral fragments being detected in excreta and wastewater. But I'll come back to what Maggie has said. there is a lot also of caution among our community of experts, because those detections, if you will, are based on RNA, nucleic acid fragments. So they may not necessarily be infectious. So only one study has shown viable virus in excreta, and there is some concern and caution about whether that, is actually the case. The main message we have is we do not think at this time that the sort of fecal oral classical route of wash-related disease is a main transmission route at this time. So hopefully that is clear. There's a little bit of kind of devil in the details in terms of how things are detected. But we do know that excreta is hazardous. And in the chat box, I saw people talking about some of the classical pathogens in excreta. So we need to just continue to do safe management of excreta as we always do. But there's no need to kind of panic and think this is, a major transmission route. So that's the wastewater one. Let me see, Katerina was there. I just need to get back into the chat box.
Let me unmute myself. Okay.
Yeah.
There have been other questions.
Katerina, maybe while you're looking at those, I can just jump in. There was a good one that came up about coordination. And I think, there's been a lot of discussion about what we've been calling the humanitarian development nexus. And I think this is a good example. I mean, when we talk about kind of linking humanitarian and development, I think it really goes both ways. It goes one, and, a lot of the discussions that we've been having, particularly with countries that are newly affected, are really around how do you shift from your development systems into humanitarian mode. So retooling, building capacity of, for example, health outreach workers to be able to be using messages on COVID. How do you retool messaging systems? How do you use private sector, outreach through advertising to be able to do this for public service announcements? So I think right now we're looking at the shift between how do we take development assets and transform them into at-scale humanitarian response. But as Katerina was saying, as we move into this response, we also want to be looking at how what we're doing during the emergency becomes assets for development. And I think this is where, rather than seeing this as a setback on progress on the sustainable development goals, we need to also see how are we strengthening country systems so that we come out of this with even stronger water sanitation and especially hygiene, behavior change, things, because we know, the report from the JMP that came out in 2019 reported that 3 billion people didn't have hand washing facilities at home. So, I mean, could this be a real opportunity to actually exponentially kind of shift the curve here on really making sure that the practice of hand washing with soap and water at home is something that becomes, really foundational. So I think that's what, there's no magic bullet here, but it's really for each country to look across, your whole stakeholders, private sector, government, civil society, and see how all those assets can really be put into service for this humanitarian response. And coordination will be essential. Government coordination with partners, coordination with donors. Yeah.
Thank you so much.
Yeah.
Thank you so much to UNICEF and WHO for being here with us and also for the answers. I have WHO has been frantically typing answers in the chat box, the chat that we are sharing with all the participants. And we need to move now, because some of you were asking us for examples of good practices. So we'll do it now. There were questions that remain unanswered. How do you ensure social distancing, for example, in crowded refugee camps or even in informal settlements? And how can you tell people to wash their hands if they don't have access to water, either in crowded urban places or in rural areas. And obviously, this is a question that we have been asking ourselves for decades. And now all of a sudden it becomes more present. Let's not, I was recording a video the other day, let's not forget about all of these challenges, and let's unite as a sector to raise the political visibility of water, sanitation, and hygiene as important for life, for dignity, for health, for everything. So let's not forget what we are living now, and let's keep fighting. Very good. Okay, thank you to UNICEF and WHO. As I said, we are running late, and I will move to the next segment, which is we will now have interventions from 3 government speakers, and these are colleagues who are at the front line of this crisis. We ask them 3 questions. Number 1, what responses are you putting in place to ensure continuity of services, especially to the poor in the context of the crisis? That's number 1. Number 2, what activities has your country done to effectively prepare for the emergency, including for people who live in densely populated areas such as informal settlements? Number 3, how are you coordinating what Kelly was referring to and sharing information with other actors who are critical to your response? I will first give the floor to Mr. Pom, who is the Director General of Technical Affairs from the Ministry of Rural Development in Cambodia, to speak first. Mr. Pom, it's my great pleasure. I hope that you are not driving as you speak, because we don't want accidents. I give you 7 minutes to share with us your questions to this, your answers to these 3 questions. Thank you so much.
Hello, can you hear me now? Okay, good. Good morning, good afternoon, good evening. Actually, it's night time here, and thanks for your care, Katarina. Actually, I'm parking right now because I'm not driving, of course. So, yeah. Let me start what we have done in Cambodia, actually. Responding to this COVID-19 has become the top priority for our government right now. And we have taken a very strong action from our leaders, our Prime Minister and our Minister as well. And we are trying to do from many fronts actually, but I'm focusing on both fronts more than other sectors actually. Our Prime Minister have take a very serious action in terms of the prevention and in terms of the awareness raising as well. So what we have done so far, we are trying to mitigate the risk by sharing the information with our people about this new outbreak, and also we send the messages to our people, what is it about, and then how to taking care of themselves. And in terms of the outbreak that we are facing right now, the latest figure is we have 96 actually people infected, and 10 are fully recovered right now, so 86 more are under treatment. And we are providing the testing for those who are suspected, and we provide the treatment for those who are affected for free. Our Prime Minister have said that we are a poor country, but we have a big heart, so we provide treatment for free for those who are affected. And we provide the hotline for those who have the question, or for those who are having the feeling that they are not well or something like that. They can call the number, which is 115. So this number can be used for all. Everybody can communicate, can ask questions, can consult with our expert and so on. Next slide, please. And in terms of the coordination, actually, we are trying to use the existing platform that we have. Fortunately for us, we have the platform, we call it RUSH. RUSH is referred to Rural Sanitation and Hygiene Group, which we work closely between our government agencies and also development partners and NGOs. So we call an urgent meeting last week actually, and then we're trying to discuss what can we do to try to do the prevention in terms of wash. So we're trying to use this platform at the national level, and also we're trying to use the existing mechanism at the sub-national level, which we call it provincial working group, and other platform that we already have at the district levels and commune level as well. And I would like to take this opportunity to thanks to our partners, especially UNICEF and many other partners and NGO who taking very strong action together with our government to respond to this. And we have done quite well so far in terms of the awareness raising. So our strategy is quite simple actually. First of all, we're trying to raise the awareness to let the people aware what is it about this COVID-19. And then we're trying to simplify our messages in terms of the how to prevent from this kind of spreading. So that's what we are trying to do. And what we have done so far, we are trying to go straight to the community themselves, to the households, to the individuals actually. So we're trying to send our frontline people to those provinces, to those districts, commune and villages. So we're trying to raise the awareness on one hand. Again, we're trying to use this opportunity to reinforce our WASH mitigation with this outbreak opportunity. But we're trying to simplify our messages as well. So we work very closely with our large agencies as well as the local authorities and our partners and NGO. And we try to use other local leaders to take part with us as well, even the religious leaders and so on. Next slide, please. Yeah, and so far we provided with the, in terms of the treatment, we are trying to prepare ourselves right now. What our Prime Minister have provide the instruction, the guidance is that they're trying to use the hotel as the treatment facility, and also they're trying to use the schools, dormitory actually of the school as the preparedness in terms there's a big outbreak, for example, then we need to use our hotels at the national level, at the town or at the provincial level as well. So, for example, in Phnom Penh, we use one hotel, it's called Intercontinental Hotel, and we use the public hospital, and we use the army hospital as well as a treatment for those who are infected. And also we're trying to work together as a team actually, and I really appreciate what we have done so far with the government agencies, large agencies, and also the development partners and NGO, which we're trying to work together effectively. We work together at both at the national and sub-national level as well. And we provide the mitigation to the public area as well, because for example, we in many public areas, we trying to monitor the health of the people by using the temperature checks measure, and also provide the hand washing facilities and so on. And to mitigate further, the government also instructed to close down those entertainment facilities like we call it beer gardens and schools and so on. So we're trying to avoid the crowded places. So that's what we have done so far with the government. Next slide, please. And MOH have taken very strong action in terms of monitoring the outbreak. We have the daily update. Actually, every day we provide the update, how many new affected, and then what are the situations so far and so on. So we have the link to that. Actually, you can refer to, we can have the link to that. So, and then also we established the so-called the National Committee for combating this COVID, which is chaired by our Prime Minister, and several line agencies are the member of that. And also the provincial and district governors are there also. And we got the collaboration from other country as well, like Chinese, for example, they provided some support to us. And we mobilized the so-called volunteer doctors, actually. And our Prime Minister just met them yesterday, actually, to discuss about what are the strategy, what are the mitigations that we need to pay attention on. And we're trying to mobilize the resource from the donors, from the volunteers, from the people, and so on. So far we managed to raise about 9 million something already. So that's the fund that we are trying to raise for this COVID-19 response. But our Prime Minister has said if we can save some fund, then we can use this to support the hospital later on. So that's what we have done as well. Next slide, please. Yeah, and at the same time, we use a lot of social media. For example, we use department's page. We use the health ministry's page and so on to raise the awareness. And then also we are successfully advocate for yes. It will be done within 1 minute or so. So we're trying to advocate for more free spot for TV advertisement, and then also LED billboard and so on. So we're trying to do that everywhere at the national level, also the provincial level, and the billboard along the road as well. So that's also a good mitigation so far. And we have created the live update, as I have shared with you, which we can see it through the link what we have. Yeah, and then now we are in the stage of expanding our efforts because we want to reach as much as we can to the local household, actually, because we cannot organize a mass meeting, of course. So our strategy is to reach the biggest number as we can to the household themselves, so that they can have the better awareness about this, and then how to protect themselves from this any spreading of this. And we have produced a lot of IEC material. You can see from the link there. So next slide, please. Yeah, next slide. Yeah, so those are the link which you can have a look. But at the same time, we are trying to formulate more IEC material as well. So we're trying to use our existing, modify it if it is possible, and then trying to develop the new IEC material so that we can have a better awareness raising by using those kind of IEC. Yeah, next slide, please. Yeah, so again, those are some IEC material that we have used. So the rest is just the picture. Next slide. That of course I don't think you can read because it's in our language, but some pictures there that we have used so far. So some video spots for awareness raising as well. Next slide. Yeah, so these are some links for your information only. Next slide, please. Yep. These are some activities that we have done so far with when we go to the community, when we go to the household. So that's it from our side. Thank you so much.
Thank you so much, Mr. Pom, for your very comprehensive presentation. We are receiving many questions that I would like us to discuss at the end of the three presentations. Some of them relate to gender, to the fact that women bear the brunt of dealing with hygiene. How can we make sure that they are not overburdened? How do we make sure that people who are isolated get access to information, including also people with disabilities? How have countries dealt with the mass misinformation that we all are faced with? And how do you make sure to do, and you refer to it briefly, community sensitization at the time of social distancing? So these are some of the questions that people are raising. So thank you so much, Mr. Pom. I will give you 10 minutes at the end to answer the questions. Please start thinking, all of you, of them. And it's now give me just 1 second.
It is now my great pleasure
to give the floor to Madame Hélène Gregory, who is the Director of Rural Sanitation at the Ministry of Sanitation for Cote d'Ivoire. Mrs. Gregory, please, I'll give you the floor for 7 minutes. So please try to use the 7 minutes. Many thanks. Many thanks, Katarina, and many thanks, everybody. I wish you good health to you all. And really, I encourage you. I have to say that in the Ivory Coast already we had some changes with the confinement promulgated by the Health Ministry, and the National Security Council was set up, instigated by the Prime Minister, and many measures were then taken. Amongst these measures, we have the school closures. All the schools have been closed now in the Ivory Coast. We also have the strengthening of sanitary and health controls on land and maritime borders, and also the support in terms of behavior linked to hygiene and food hygiene and food safety, and also with the alcoholic gel and the interdiction to basically give each other a hug and to shake hands, because this is one of the main modes that we need to prevent. And also we have forbidden the consumption of meat that is not properly sourced, and also we have forbidden gatherings of more than 50 people, and also we, for the Ivory Coast, we have different regions, east, west, and all the regions are taken into account with their prefects who pilot this committee, with regional directors for health and safety who monitor this in terms of the diagnostic and the taking care of the suspected cases. We have to confirm that, and we also enhance the safety for our health personnel and our health staff in terms of research, and for the committees who are tackled with fighting epidemics. On top of that, the president has promulgated urgent measures that apply to the whole of the Ivorian territory, and from now on, at midnight, the whole city of Abidjan will be confined, which means that people will not be able to go to the street. At the moment, there are no declared cases in other cities apart from Abidjan. So Abidjan will be on lockdown. There is a curfew throughout the territory. As for the health ministry, we have to say that there is a lot of awareness raising from the Ministry of Health, with the Minister in charge of Health Matters and the Minister in charge of Women's Matters, in order to raise awareness in sensitive areas, which is very important, especially on markets where you have a lot of women gathering and concentrating, where the outbreak, and where rather raising awareness is very important at scale, because we know that a lot of women are there, and a lot of them do not have any proper school education. So there is a lot of awareness raising modes being set in place in order to raise awareness throughout the Ivory Coast. And on top of the French, which is the official language, there are more than 60 ethnic groups, and most of the rural communities do not necessarily understand French, and therefore these awareness raising methods and messages were translated in the local languages so that the communities could understand really the importance of that problem. As for the Health and Safety Ministry, Mrs. the Minister is strongly involved in order to contain and manage the household waste in order to make sure that there is no added problems that will be linked to household waste. And our minister is on the ground in order to check and to monitor the places where we already confined suspected people with suspected cases, so that we make sure that we will have proper bins in place to make sure that we will have some soap available, some bleach available, and all these kind of products, so that the people who are infected or ill could at least be in good sanitary conditions. And also the collection of this rubbish is taking place daily. But we already plan not to mix this rubbish and this waste to household waste. So already there are some decisions being taken in order for this waste to be dealt with in a specific manner and separately from household waste. We're at the end of March, and soon we will get to the rainy season. And in terms of sanitation, there are also measures so that we do not maximize that problem. So Mrs. the Minister is looking after this area, and some instructions were given for all services in the whole of Abidjan, so that all these services can manage the sanitation on an urban level. As for the rural areas, as was stated earlier on, there are some prefects and regional directors already in the various regions, and they are working in order to be able to bring that message to the most remote parts in the country in order to avoid that. We just hope that we will manage to keep these cases in one particular area and deal with it that way. But this necessitates a lot of awareness raising, and the various ministries are collaborating together. So the work minister is collaborating with the health minister, and they are distributing some hygiene kits with some hydroalcoholic gels in order to wash your hands, etc. So these are the kind of things that we are putting in place as of today in the Ivory Coast. Many thanks. I thank you very much, Mrs. Ragouri, for being with us in such a busy time and such a difficult time for your countries, such as for other countries, and especially for you with your position. We are receiving a number of questions. Some of them are of a technical nature, and therefore I would like to attract everybody's attention to the technical notes that was drafted by UNICEF and the World Health Organization, which is available, as was stated by our colleagues from the World Health Organization. This is available in 6 different languages. We will share this with you, and you will find some answers to your technical questions within that particular note. Another question that you might be able to give us your answer, Mrs. Bragory, if you agree to do so, a little later after the presentation for the person responsible for these matters for Colombia. There is one fact that you mentioned: the country is more and more confined, in confinement mode, in isolation mode. So how do you manage, and this is a question raised by participants, how do you manage to have some awareness raising campaigns, especially with some persons and people who do not have access to social medias, and as you have stated, they have not necessarily been to school, and how do you manage to do so in such particular conditions? But first of all, I will now go to Spanish. One moment.
Now, Dr. Claudia Cuellar Segura, Deputy Director of Communicable Diseases, and she is part of the Colombian Secretary of Health. You have 7 minutes for your presentation. Dr. Cuellar. Thank you very much, Katarina. Thank you, everybody. I would like to tell you that Dr. Alejandro Becker is here with us. He is an advisor to the Minister of Housing and Development of our country, Jonathan Balagon. This is an overview of our actions as a country. Among our actions, we've been working in 3 phases. We initially worked in a preparation phase, which started out in January with periodical risk assessments involving all of the sectors, depending on the news we received from the WHO on what was happening in China, and we began to centralize efforts. Once the first case was confirmed on March 6th, we centralized efforts through the presidency of the country and unified command posts were created encompassing the different sectors of government entities. We started to assess the different strategies to be created as well as the corresponding guidelines. Once the first case was confirmed after the preparation phase, we reached to the contention phase that leads to quick detection of confirmation and follow-up of the different cases. We created 3 guidelines and a series of activities in the different sectors, and each competency analyzed all the different matters regarding the disease, everything we already knew about in the preparation phase. The different ministries got together to analyze the different contributions to be made from the different sectors, from the Ministry of Health in terms of risk, communication, engagement, understanding, and how we could communicate the information to the different sectors, because sometimes we're talking about very technical issues, and we had to clearly understand how the information is going to be conveyed to ethnic groups or religious congregations in order to convey the different measures required, because the situation in Colombia is very specific. Geographically speaking, we have urban, rural populations. We had to assess the resources as well. The Ministry of Health released preventive measures declaring a sanitary emergency. And we also implemented major control on migration, airspace control, entry measures. We shut down the schools, initially public schools, but the measure scaled up. And yesterday we started full quarantine all over the country. We are also evaluating certain models, and we're trying to understand the behavior, because the maximum peak, what we want is to flatten the curve. This is why we implemented this measure, not up to May the 30th, but the initial quarantine will go up to April the 13th. We want to assess how these actions work. In the health sector, as you can see, 470 cases have been confirmed. Most of them have been imported. And we're talking about long and contained chains of communication. We have managed to contain the communication so far. Next, please. All these actions following the WHO declaration, the measures were implemented by the health ministry, and there was a resolution declaring the emergency, and there's also social, economic, and environmental emergency throughout Colombia, because we want to limit possibilities of communication. And the number of meetings are now limited, and we have a curfew throughout the country for certain sectors. So we're talking about fairly specific actions all over the country. All of our actions are articulated now, and I'm not only talking about the local instances at Colombian level, but the PAHO, UNICEF, the WHO, the different health-related agencies are now working together. And since the Ministry of Health is also a member of the Water, Sanitation, and Hygiene Commission, this is why we're all here, because this is an extremely important topic. As we've heard in previous presentations, hand washing is the most important strategy to reduce the communication of this infection, as well as other preventive measures, education, culture, and habits. Perhaps these are not easy to implement it in our country, but little by little, the population understands that we're talking about stringent but necessary measures. Water and sanitation was one of the main topics dealt with even before the first case appeared. From the very beginning, when we started to identify, we created communication strategies with technical sheets, news infographics, and we started training the health secretaries throughout the different states of the country, because they are the arms we have. They enable surveillance, vigilance, and we support the mayors, the governors, the authorities throughout the country. We did it using different mass media channels to communicate with the population, to communicate proper hand washing, frequency, personal hygiene. And we are also talking about dry hand washing, because it is true, we don't have running water in a lot of areas of the country, and my colleague will get into that in a deeper way. But we have a series of recommendations for water for human consumption. We have different recommendations for treated water, or what happens if water is not treated, how storage will be made, and if you have access to water, you shouldn't boil it if you're going to wash your hands. Like, these mechanisms have led us to different actions. Next, please. Next. Dr. Becker, it's your turn. Hello, I'm here. Hello, everybody. Good morning, good afternoon, good evening. Thank you, Claudia from the Colombian Health Ministry. Thank you for your presentation. Thank you, everybody, for having me. And very quickly, because I only have a few minutes left, I'd like to talk about three very specific things. The coronavirus crisis comes at very difficult times in Colombia, because there is a drought throughout 320 municipalities. And in addition to this, there's the rainy season coming throughout 670 municipalities of the country, because we're starting winter. So the coronavirus challenge poses yet further challenges on water supply, namely in the top rainy season in April, May, June, and July. Can we move to slide 14, please? Slide 14. This slide describes our three major interventions in order to guarantee first, emergency supply for all the population using different tools, the different mechanism, the sewage system, the drainage. In addition to conventional systems, we want to bring water to everybody because, as Claudia mentioned, water will save us. The second measure package is to ensure proper supply and permanent supply. So the water, sanitation, and sewage departments should have monetary liquidity, cash flow, so they continue to operate in these times of crisis. Because in addition to the weather conditions that I mentioned, the Colombian peso is now depreciated vis-a-vis the US dollar. And amidst the coronavirus crisis, we all know that raw material flow will or may be at risk. So we have to guarantee water supply to all. So those measures have already been taken. And since throughout this period, mostly the vulnerable population will have trouble to pay their bills, if we do not collect money from that population, we should extend soft credits, or we should grant subsidize, or try to collect that money from other sources, because the vulnerable population should be in conditions to have access to water, and we shall also guarantee that they get paid their salaries while also assuring proper care of operators. You know, the peak of the crisis will come if water operators and if workers in this area should get sick. That would be terrible. And among this packet, we have also included additional measures for equipment maintenance in the networks, as well as to provide maintenance to our operator systems. We will also strengthen the interinstitutional coordination mechanisms with the environmental sector as well, throughout the region and throughout the municipalities inside Colombia. So we have created coordination interinstitutional roundtables in order to monitor the crisis and to issue measures accordingly, and bearing in mind the specific framework inside Colombia, because we are made up of different islands. There are different cultures. There are different cultures operating inside Colombia. So we have a lot of differences, but we are connected at the national level in a unified command post created by the ministries. And we, as the Water and Basic Sanitation Ministry, are leading the efforts. This is the scenario. These are the measures from the protection side of users, of the households, and the most vulnerable population. We are breaking down our activities into three, because they're going to bear the costs of the strategy. We are going to reconnect the households that had not paid for water supply. You know, right now, although people may be in debt, they still have to have access to water, although they may be in debt, and we are reconnecting them to water supply. Next, we're protecting users in terms of what to do with the households that cannot afford or cannot make a payment right now, because we know that this crisis will not be over within 2 weeks or within 1 month, because we believe in a pessimistic scenario that we will have to ensure 30 days of water supply at least. So we must extend credit and payment ease for the population. We have to also guarantee there is proper cash flow. Finally, when it comes to protecting users, we must create different mechanisms in order to guarantee access to running water and fresh water to areas where no networks exist. So we are contemplating how to provide access to marginated neighborhoods. We're working tightly with governors and mayors so we can bring water tanks to their populations, or PVC water tanks, so to water containers to the areas for hand washing, for proper sanitization, or using a well system. You know, we must also guarantee that there are portable and movable water plants to provide sufficient purification resources. In slide 17, you will find the different measures taken by Colombia to protect water operations to ensure both continuity and quality. Bearing in mind that we must protect our staff so they do not get sick and we can meet the proper water, sanitation, and hygiene measures. In slide 18, you will find everything about interinstitutional coordination within the unified system. Now I'm ready for questions. Great, thank you both, Claudia and Alejandro, for such interesting presentations. You just clarified a few questions I had when I took a look at your political statement or the newspapers. You know, I wasn't acquainted with the details. And now, Alejandro, after your comments about ensuring cash flow for water suppliers to ensure continuity of services, I think that is extremely important. Now, I'm going to give the floor to the colleague from the World Bank, Gustavo Saltier. He's here with us. And, you know, I already got lost with so many papers I have. Gustavo will now share the World Bank's plans.
Gustavo will comment on the World Bank plans to support water, sanitation, and hygiene in the context of COVID-19. The World Bank has approved a $4 billion package for health in the context of COVID, and they are now working on a water, sanitation, and health package, but they are also working on other ideas. So, Gustavo, in 5 minutes, could you share all this information with us, please? Then we will have a session. I will give the floor back to the participants to quickly answer some questions. I might ask just one broad question, and then we will need to end. Let me just tell you something, that from the beginning of this webinar until now, we are having approximately 800 participants present, and the numbers have stayed stable. Gustavo, up to you now.
Yes, Katarina, can you hear me well?
Very, very well, Gustavo.
Okay, good morning, good afternoon, and good evening, everybody. And thanks for the invitation to provide some comments. It's a fascinating session. Thanks, everybody. SWA, the ministries, WHO, UNICEF. I'm going to comment the focus of the World Bank response to the COVID emergency, in addition to what Katarina was mentioning, which is the approval of an initial package of $6 billion to support initiatives in the health sector, focusing on the emergency. But I'm going to comment on what we are planning to do in WASH. And basically, we will focus on three priority areas. First, WASH in healthcare facilities. Second, WASH in communities, especially in vulnerable communities. And third, support to utilities. The support of the World Bank will be agile. We will put in place mechanisms to deliver quickly the resources to the countries through existing operations or new operations. So let me summarize. First and foremost, our initial line of work will be to support WASH in healthcare facilities, very much along the lines of Kellyanne and Maggie's presentation from WHO and UNICEF. So I'm not going to repeat, but it is to support activities such as the ones that they described. The second, also very much along the lines of the presentation of the Ministry of Housing and Sanitation of Colombia, strong support to water and sanitation utilities to ensure continuity of water supplies, water quality. There was some discussion before about chlorination and the importance of disinfection, enhanced monitoring to ensure staffing levels, continuity, provision of spare parts, pumping equipment, etc., etc. The financial support will also, from the bank, will also include cash reserves, chemicals I mentioned before, in particular chlorine, availability of electricity fuel for pumping and treating water, and also resources for routine maintenance. Third, WASH in communities. Here, we will provide different types of instruments to provide quick access to WASH services. For example, equipment for compact water treatment plants, construction and operation of water points or water kiosks to deliver water in strategic urban or rural areas. Provision, this is very important as well for the emergency, water trucks or tankers for delivery, different types of water instruments, bottled water, sachets, but also with the traditional tankers. Also provision of water storage for the operators. Fourth, to ensure resources to ensure supply chains for hygiene products availability in the markets like soap, disinfectant, point of use for water treatment chemicals, etc. Also to deal with some restrictions to imports and exports, that will be another activity. 5, emergency response to fragility, conflict, and violence. Countries affected by fragility, conflict, and violence. This will be a special line because these countries will be affected by extraordinary circumstances. So the World Bank will focus on WASH in those areas as well. 6, communication and preparedness related to hand washing behavior. Behavioral change and promotion. And finally, I would also like to highlight that the World Bank, together with different global partners, will open a technical assistance window. SWA will be one of our partners, but also other global and regional organizations. And this will be a worldwide network with our countries, partners, development partners, utilities from all over the world, water technology experts, basically to share in a simple portal what are the good practices, and deliver just-in-time technical advice for those in need. We are working to set up this platform very quickly because we believe that not always it will be about financial resources, but it will be the possibility of setting up an interaction between utilities, communities, rural service providers, and governments, of course, that may need advice just in time. How did I solve this problem of lack of chemicals for my water treatment plant? What are the other options? What type of pumps are available in the market? What other alternatives? How do you install them? Etc. etc. We will set up this platform for interaction. So, Katarina, let me stop here. Thanks for the opportunity, and happy to respond to any questions. Thank you. Back to you.
Thank you. Thank you so much, Gustavo, for presenting to the participants these two initiatives or responses by the bank. As I told you, there were many questions, and the questions, I think we will need to use the questions at SWA in order to come up with other webinars, because there are some issues that keep coming again and again and again. So we will get back to you soon on that one. For the 4 country participants who spoke before, there was a question asked among the participants, which I thought is very interesting and which I have asked myself a lot. And it's a bit of a provocative question, and I ask you, since we are here in this small group, to try to be as frank as possible. Do you think that this pandemic and the centrality of water, sanitation, and hygiene in the context of the pandemic, and the visibility that water, sanitation, and hygiene have been gaining lately, do you think that it will make sure that the politicians in your respective countries, your policymakers, will make sure that WASH really becomes a reality, a priority, not in the policies, but also in the national budget? Are you seeing anything, any trend, any difference? And what can we do as a global community to support you in your advocacy efforts with ministers of finance? As you know, we were supposed to have had the finance ministers meeting, which was postponed until the 4th quarter of the year. What are the messages that we need to deliver to decision makers, and how can we help you deliver certain messages to decision makers to making sure that water, sanitation, and hygiene remain a high priority, and that we can see that in the figures in the budget? Thank you. Maybe we start in chronological order. I would start with Mr. Pom. Are you still there, or did you get disconnected? You are there.
I'm still here. Yeah, I'm still here. Yeah. Thank you. Thanks for my colleague, actually, Sandeep from UNICEF, who make a good summary of the question to Cambodia, and then I will answer briefly to your question as well. One question about the community sensitization and ensuring social distances. For us, we use the loudspeaker, a mobile loudspeaker. It's a one means of communication. So it's quite effective so far, because we use the truck, we use the even the horse cart or other means of transportation, putting on the loudspeaker to raise the awareness of the people. So that's to avoid this, any transmission of the disease. So from house to house, we also use the IEC material, but we still keep the distancing, and we ask our frontline people to wear masks and other protective gears as well. So we trying to make sure that we are safe to do so. And other question related to the coordination, actually, for us at the sub-national level, we work as a team, because government has formulated the COVID response team, and we work very closely between the line agency and the local authorities to that response. And also related to the the messages that we have used so far, the main focus is hand washing, of course. So we are trying to address this critical issue of hand washing during this outbreak. Related to your question about the opportunity for the advocacy, of course, again, this is we believe that this is an opportunity for fundraising for resource mobilization. So we will try to advocate for more funding from all sources, all potential partners and donors as well. So in the National Action Plan we have shared, actually we already indicated what are the needs for this WASH. So use this opportunity, we need to do more in terms of the advocacy to mobilize more resources for our WASH sector actually. Thank you.
Thank you so much, Mr. Pong, for having answered my question, but also for having taken into account and addressed other questions that were directly addressed.
Now this is your turn, please. This is very interesting. You mentioned many questions regarding confinement. How do you manage to lead some campaigns to people who are now confined or isolated, some people who are not school educated, as you mentioned, etc. And also, I think that it would be very interesting to understand the efforts from multi-stakeholder parties and the coordination that you are leading at the national level. Many thanks, madam. Many thanks, many thanks. I also wanted to thank the European Union also, who has already led some campaigns in the country, and we have already worked with UNICEF. I made a call and I talked to Madam Kelly and also with Dinar regarding the setting up and taking care of the Committee for Vulnerable People. Regarding the population that is confined and isolated, there are already some trucks that are equipped with loudspeakers. They go by and they communicate the messages in different languages, in different local languages, as I stated. And I insist on this point because it's very important for us. The message transmitted in French, that will lead to some difficulties because many people will not understand the main exact terms from these French messages that will enable us to battle and fight the epidemic. And also the government has mobilized the whole of the government. And we have also raised 15 billion CFA francs. And also for coordination, the message from the Interior Ministry has made sure that we can use the essential staff so that they can be tasked with dealing with any lack, any waste disposal, and also in order to stack the shelves in the grocery stores so that the population can also go and get the food. So that is what I want to say regarding all of these decisions. Yes? Many thanks. And also, we have some local radio stations. Some local radio stations, so that even in the most remote villages, you also have some local radio stations. Even if people don't have access to telephones and so forth, we have some local radio stations in the most remote areas. Many thanks. Many thanks, madam, for enlightening us and for sharing the best practices that you have just mentioned to us. This is something that on our side, we will be absolutely delighted to do, which is to share our best practices and these examples of the measures taken by various countries in order to tackle COVID-19. We have already a number of examples, and as I've said, I've got too many papers here on my desk, but yet we've got some examples from Colombia, from Nigeria, from Peru, from South Africa. So we are receiving a lot of information from various parties and partners, and we will be pleased to share that with everybody. and with you now in order to finish and close.
I wanted to pass the floor to our colleagues from Colombia just so that they can answer just all the questions that we have raised so far, if you may, of course. So how about the fact that these pandemics are maybe used as a warning? How can we make sure that political decision makers can invest further in coming years in terms of these WASH terms? Thank you for everything. Dr. Katarina or Dr. Becker, who would like to answer? Well, I would like to start just by stating three points. So we're talking about the fact that this is the perfect time to start just really raising awareness on how important water is to transform people's lives. And this crisis has just triggered all warnings in this regard. Well, first and foremost, because we need to be very careful. More specifically with this crisis, this is not going to be perpetual or anything like that. We just need to really take immediate actions and also just see what we're going to be doing afterwards, after we have overcome all of this experience of just being able to react specifically in this point in time, and also to just link water as a transformative element, specifically for certain social situations. And water is a raw material to tackle our health issues with our people, with the most vulnerable persons. And number two, water can be used as the key element that is going to allow us to tackle this poverty that we have been facing. And now is the time to make all proper adjustments that are related to these budgets that have been allocated for social investments, and to make sure that this fight against poverty continues, and that this battle is more and more effective, and also to be more creative. This is also allowed to put all of these efforts together. Today, technology, our response capacity in terms of communication could also be useful for us to be able to develop different mechanisms so that we can provide with drinking water to the most vulnerable populations. And this is also first is to just think outside the box, to find new ways, not only by means of a pipe. That's not the only way to supply water. And beyond those 3 points that I just mentioned, I would also like to state that this has been very useful to just create, let's say, or raise more awareness amongst our people, so that people can start just really being more environmentally aware, so that we can really start collecting water when raining times come. And this is the best chance, this is the best timing, not only for leaders to be aware of the situation. Of course, we do need them to be aware of all of this matters, because once more, water is a transformational item. And on the other hand, we need to raise awareness on the environment, its protection, and how important and significant water is for the life of the whole planet. I have a question, Katarina. In addition to what Dr. Alejandro has mentioned, it is also worth noting that the mechanisms that we have put in place to start just closing gaps, to finish with this inequality, and to start driving all of these policies. So one of the main challenges is particularly just sustaining all of this for the long run, not only considering the timing, the specific moment. We have always thought of this topic as a key subject, because it is really concerning just all of the population, not only the most vulnerable parts of the population. Somehow the government has has really had this need of just putting a lot of stress on this subject. This is one of the main topics that needs to be protected, just ensuring that the whole population, the whole world gets water. This is a type of changes that we're driving. This is not an easy job to do, but well, this is something that we need to do. Okay, thank you so much. I would like to thank you all for your great words and final remarks. I'm really thankful for all of that. And when you were talking about technology is what is really putting us all together. We're 800 persons, each and every one of us at home. We are discussing, we're sharing our best experiences so that we can just continue moving forward in this regard and to continue providing support to all of those in need. I believe that Gustavo Santiel from the World Bank, well, he had to leave. No, I apologize. Are you still there, Gustavo? Do you have any final remarks or comments? Is there anything else you would like to address? Because he was telling me that he was going to be able to stay for just a couple more minutes. Anyway, Gustavo has allowed me to share with all of you, all 800, well, his email address. So I said, okay, are you aware of the fact that there are 800 persons? And yeah, that's okay. So you could just write directly to him. So before we wrap this up, I was going to pass the floor to Kelly and Bruce, both from UNICEF and the WHO, so that, well, they have their own final remarks, 2 more minutes, and then we are able to just wrap this webinar up. Thank you.
Maybe I'll just jump in really quickly. So I think, you know, as we've all said, I mean, this is really, I mean, the biggest challenge of our time. And I mean, as the WASH sector, I mean, we are on the front line. So it is up to us. And, you know, I think it was so inspiring for me to hear from the 3 countries, really kind of how you're taking this into such a concrete response. From UNICEF, we've received requests for support in water and sanitation from 105 countries. So we've been reviewing all of those responses and really looking forward to working with you all on the ground. I think just, you know, 4 final messages. One is the need for speed. This is something that we've got to get going fast. I think we've seen some great examples today. The second point is build on what you have and adapt that for your local response. I really appreciated the examples. If you have horse carts and megaphones, if you have cell phones, if you have radio, I mean, use all those assets to take this, you know, to the people. The third point is just, you know, keep the water and sanitation systems going, because, you know, we can focus on the response, but the response will only be effective if the water utilities, sanitation providers are able to keep doing their jobs and keeping those workers safe. And the final thing is just that we're all in this together. And I think, you know, the coordination, and this is something that the Sanitation and Water for All Partnership has as kind of a principle, is that we all work together, all sectors of society. And so this is a chance for us to really put in place that power of partnership. So, you know, please, as Katrina said, we're available and ready to help as needed, so that you can put this in action where you are. Thanks so much. And thanks again to SWA for organizing this.
Well, I think, Kelly, you said it really, really nicely. So I won't repeat any of your thanks, but I've been amazed at this virtual technology. This was, well, it was kind of seamless, but just that all of us got together. I've never seen anything like this, 800 people. And I don't know how it was done, but so I'm sitting here trying to get the kids out of my room and learning so much from all the participants. The only other thing I would say is, maybe 2 points. One is the need for speed, but I think we really at some point need to think about that transition to sustainability and use this as a platform to kind of keep the momentum up, specifically on hand washing, because we see that drop away quickly after other disease outbreaks. And the other bit is this evolution, because if there's ever a time that we need to learn from each other, I think it's now. No one can keep up with how this is evolving. No one can predict what will happen next week. And so just to support Katarina and all of our actions to kind of maybe have more webinars so we can keep that interaction going, because I certainly learned a lot and I was inspired by the countries as well, and we're here to help. So thank you. Over.
Thank you so much, everyone. My colleagues, as you can imagine, in the past 2 hours have been WhatsApping me and Skyping me frantically. And one of the things they were saying was, we were sitting for 2 hours and it didn't seem that we were together for 2 hours. It was so interesting, fascinating, and motivating and encouraging. It seemed that we were together for 15 minutes. So we need more. We agree with you. And I must say that at the beginning, I was having some, and our colleagues, some reservations about organizing the webinar, whether people would join or whether people were too busy. But now we feel that, well, you have joined. And thank you so much for having been with us for these past 2 hours. And we will organize more webinars. I think this has been an excellent experience. And I'm grateful for all of the work that you put behind this webinar, UNICEF, WHO, also my colleagues, but also the different countries that participated. We are planning more webinars, and then we are keen to ensure that water, sanitation, and hygiene services are well integrated in the COVID response. For this For this purpose, we are thinking of different mechanisms, bringing the sector together, having a call to action, or having a joint statement to call on world leaders to keep the priority for now, but also for the future. We will continue compiling experiences that we are hearing from different countries, focus on what you are doing to make sure WASH services are available to all, always and everywhere. If you want to contribute experiences to this compilation, please write to us. It is our collective responsibility, but also a chance in a lifetime, as Kelly was saying, to transform this enormous challenge into an opportunity to make sure the response to COVID is not only a health one, but a WASH one. Hence, we must make sure decision makers understand that and act accordingly. We must act as a strong sector and convey the message. This pandemic is a huge health, economic, and social challenge, but it can also be an opportunity to create a global movement in favor of water, sanitation, and hygiene for all, always, and everywhere. So please continue working with us, including on COVID, share ideas and proposals with our team to mobilize political action, thought leadership, strengthening transparency, mutual accountability, increasing investments for the sector, and improving efficiency in the way we use resources and work together. So to all presenters and speakers, thank you so much for your leadership and effort. Also, thank you to Spark Street for this seamless session. Stay healthy, wash your hands, and I now officially close this webinar. Thank you so much.